The Living Well with COPD project is it has a very long journey. We've started more than 20 years ago in Canada at McGill University. And since we have done a lot of work, starting with the randomized clinical trial, many publications, and the program has been known now in Canada and across the world for the healthcare professional, including physician who manage a COPD. This is about how to better manage and better convey and also coach the patient, that the patient can live on a daily basis, but being able to cope better with the COPD. It's about behavior change. Some of these behavior are medical and other behavior are health or a better health habit that you can live better with your disease on a day-to-day basis.
It's easy to educate patients to move alone in their homes?
You know, education has many steps, very much about knowledge, and I think knowledge is the first part, but it gets more complicated when you want to change behavior. And it's about the behavior of the healthcare professional, but it's also about behavior of the patient. Then it takes time. You can improve behavior through the right experience, and then you can build through these experience the confidence that you are going to and you are doing, and you have the skill that you can apply on a day-to-day basis. And that's the whole process behind living well. It's not about content. It's about process.
Do you have already some results in Canada? Some patient-reported experience, for example?
Yeah, we have a huge amount of patients that manage their disease to different degree of disease severity. They manage at home. They are under for many supervision of the healthcare professional, and we have demonstrated through a randomized clinical trial, but also to a real life situation and publication on that this is it is possible to implement. And we're very privileged now to start working with different countries across the world. Portugal is one of those where they had the initiative with us to adapt the program Living Well, being implemented first through pulmonary rehabilitation program, and then to be disseminated and implemented across the country.
And what is the real value, the real contribution of rehabilitation programs for respiratory patients and for health systems?
Rehabilitation is a non-pharmacology treatment that has been underused, despite the fact that the evidence are really supporting strongly that you can improve patient exercise capacity, but beyond exercise capacity, you can improve patient quality of life and also a better management on the day-to-day basis. Then there is a real communion, I would say, between rehab and pulmonary education leading to behavior change through Living Well with COPD. Living Well with COPD will enhance pulmonary rehab by supporting the patient, that the patient can have and experience a behavior that he's going to maintain after the pulmonary rehab. Then the pulmonary rehab is a real platform where you can teach the patient, make sure the patient has the experience, and you coach the patient on these visit that he has with you, and then this is a real motivation for the patient to engage in healthy behavior such as exercise and physical activity.
Although it's largely recognized, the contribution of rehabilitation in Portugal, only 1% of the patients, the respiratory patients who need these programs, has access to them. It's important also to educate the doctors to send their patients to the programs.
You are so right. Then the education has to start with the physician, they're the prescriber. Every healthcare professional that take care of COPD patient or patient that have a chronic respiratory disease, and they are now large society from gold, okay, to national society that are promoting through their guideline the recommendation that the management of COPD and other chronic disease have to include pulmonary rehab. Then now it's a question of about building that in the healthcare system such that okay, they are offered and patient can have access. But it starts by the healthcare professional and the physician. Those are the ones that can really change something.
What are the key messages of your presentations in Portugal next November?
But the key messages is that you as a healthcare professional and a physician have a leadership role, and you can change something with the patient. Although the patient is at the center on a day-to-day basis of taking their medication or having the right behavior to live and manage their disease, having healthy behavior. No healthcare system are going to replace the healthcare professional and the physician in the way they coach the patient. And this is only possible through a team effort from the physician to the pharmacist to the other healthcare professional, and in the continuum of care from the primary care to the secondary and tertiary care. This is a team effort. Chronic disease and the success in chronic disease start with the patient, but the support has to be through the whole healthcare system in the continuum, and also more and more with the community. Because the healthcare system also needs support where in the community these patients can have access to facility where they can do exercise, facility where they can walk outside, and also support from their family and their community.